50 million people in India are chronically infected with the hepatitis B virus. 6 to 12 million people are affected with the hepatitis C virus. Hepatitis A virus is hyperendemic in India and is the most common cause of acute viral hepatitis in the children and the adolescent. Hepatitis E virus is endemic in India and is the one of most common cause of acute viral hepatitis in adult. Yes, the problem is huge, and here I, Dr. Vishal Bodh, Associate Professor in the Department of Gastroenterology, IGMC Shimla, stand before you to shed light on this significant day, the World Hepatitis Day, to shed light on the hepatitis, which is affecting the millions of people worldwide. Hepatitis means inflammation of the liver, that is swelling and injury of the liver cell, and is most commonly caused by the 5 types of hepatitis viruses A, B, C, D and E. And irrespective of the type of virus, it presents as a non-specific syndromic illness that begins with a prodrome of fever, fatigue, body aches, joint pains, rash, anorexia, nausea, vomiting and abdominal pain, which is followed by the icteric phase. And during this phase, the patient has jaundice that manifests with the yellowing of eyes, skin, mucosa, and is associated with high or dark colored urine and clay or white colored stool and pruritus. In most cases, the disease spontaneously subsides on its own in 1 to 3 months. But in very less number of the cases, or say 0.1 to 1% of the cases, it may result in acute liver failure and patient may have bleeding tendencies. Patient can develop hepatic encephalopathy, that is, the patient may go into confusion, disorientation, increased sleepiness, stupor and coma. So these are also the warning signs that you need to see a doctor and you need to get admitted. The hepatitis is largely a preventable disease and it can be treated and it can be even eliminated with the proper actions and proper precautions. Hepatitis A and hepatitis E virus infection is transmitted by the fecal-oral route. That is, it is transmitted with the contaminated food and water, which is contaminated with the sewage or the human feces. So it is especially common in the rainy or flood seasons. So to prevent this infection, we need a improvement in our sanitation, the improvement in our personal hygiene. We should wash hands before eating food, after using toilet, and before cooking food, and we should wash the raw fruit and vegetable before consuming or before they are used for making the food. Besides this, for hepatitis A, we have the vaccine available, which is a very effective vaccine, and ideally this vaccine should be given to all children born in India at the age of 2 years. Currently, it is not in the universal immunization program, but I strongly feel, and even Indian Academy of Pediatrics recommend, that all children born in India should be vaccinated with the hepatitis A virus vaccine at the age of 2 years. For hepatitis E virus, there is no effective vaccine available in India, but there is a vaccine available in China which has an efficacy of 60 to 80%. Now, the hepatitis B, C and the D viruses, they are transmitted with the blood and body fluid of the infected person, and there is also mother to child transmission. The transmission also occurs through sexual route. Now, to prevent the transmission of the infection, we should screen the blood and blood product before transfusion, and this is now routinely done in the blood banks. To prevent the sexual transmission, we should use the barrier method of contraception and we should avoid indulging in the high risk sexual behavior. And to prevent, we should use the disposable syringes and sterilize the medical equipment before use. If there is an infected person in the family, we should avoid sharing the nail keeper, razor, hair trimmer, toothbrushes, and all the other family members should be vaccinated for the hepatitis B virus. And to prevent the mother to child transmission of the hepatitis B virus, the institutional delivery should be carried out and baby should be given immunoprophylaxis at birth. To prevent the transmission of infection among IV drug users, they should be educated to avoid the IV drug use. If not possible, they should not share the syringes or use the disposable syringes. We should use the sterile needle for the tattooing. Hemodialysis machines, they should be sterilized in patients who are receiving the hemodialysis for the CKD to prevent transmission of infection. There is a very effective vaccine available for the hepatitis B virus infection prevention. It was launched in India in 2003 and now it is in the universal immunization program, and all the children who are born in India after the 2010, they are now vaccinated for the hepatitis B vaccine. And the hepatitis B vaccine coverage is though variable, so any patient who has not received the hepatitis B vaccination, they should get themselves vaccinated. And this is especially true for those who are involved in the risk works like healthcare worker, pathologist, surgeon and dentists. For the prevention of the hepatitis C virus infection, there is no effective vaccine available as such. But the treatment for hepatitis C has undergone a paradigm shift, and the treatment has emerged which has very high cure rate for the eradication of the hepatitis C virus. Now, there are some misconceptions regarding the transmission of hepatitis C virus infection. So, I want to say that hepatitis B and C virus infection that does not spread by hugging each other, by handshake, by eating together and by playing together. I hope you find this information useful. Thank you.